Ngak Min means healthy waters. The word Ngak Min Health was actually given by the Wik people from Djarragun. So Ngak Min works really hard to provide a holistic and comprehensive primary healthcare system that is also culturally appropriate and responsive to our clientele as well. Having Ngak Min Health on Djarragun College campus, we've taken away the barrier to access.
We have a couple of students from Western Australia as well and the Northern Territory, but a majority are from Cairns and around the Cape.
So I make sure these boarding kids get to see a dentist, as none of them probably have never seen a dentist in their life.
Immunisation is a really big part of our role as well, and all that preventative health stuff. So even just part of a health check, or even just, do you know what your period is, and being able to talk about that sort of stuff.
The students are learning their own help-seeking behaviours, and when they come into the clinic, they're comfortable coming in and accessing, a formal primary health care.
It takes a lot for our people to actually go to a health service in the first place.
A lot of these kids, Indigenous kids, they don't want to come in and think, oh, seeing a doctor is scary. So, as soon as they walk in, they are in a safe space.
Habits are formed in childhood sometimes, and doing that preventative health assessment, which is often the initial thing we get them in for, especially when they're new to the school, then we can pick up potential cases much earlier and give lots of good advice about, healthy nutrition, the cornerstones of maintaining good health.
To make sure that when the Year 12 student actually graduates, they're graduating healthy as well.
So to get through 12 years of school with a good attitude, good habits and good health, and I think there's nothing that these kids can't achieve if they have that.
1 in 3 of our kids 12 years and below have severe psychological distress. Here we are having little people carrying this weight of stress, which is trauma informed, and still having to come to school and to learn. So how do you support those little people? I do want to really acknowledge Gilbert and Tobin. Gilbert and Tobin staff members donate money out of their salary and wages, and then they decide on where they want to actually spend that money. This is the 3rd consecutive year that they have donated money to Ngak Min Health. They believe in us. That money actually helps us provide additional services, but that money was also instrumental in helping our social emotional wellbeing team set up the yarning space. It's built with bean bags and weighted blankets and sand play therapy,
where we can have an open and honest conversation about what's happening in their world, and then get them to hopefully follow through.
And that help-seeking behaviour, if they can learn that now, that's where you see those larger impacts, and especially if we're looking to close the gap in those health areas.
People at Ngak Min Health are dedicated and we're passionate, and if it's just one contribution a day to change someone's life, we've done our job.